I'll pass the microphone and controls off to Dr. Chris Kontogianis, who is, again, a very interesting, very compelling story. I obviously know him from our academy life, where he's been on the board of counselors. He's a very outspoken advocate for orthopedic surgery, and he's presenting us as co-host tonight with a intro perspective on what's going on in the Tri-Cities, which may entail very important lessons for all of us around the country. So thank you, Chris, for joining us tonight and putting together this great program, and we're all looking forward to hearing from you.
So hello, it's Dr. K coming live from Tri-Cities. I'm going to give you a little update on what's happened with medicine in the Tri-Cities and what I like to call the negative impact of corporate medicine on healthcare, and why I frequently say it's a bad time to get sick in America. A little background, I may jump around here a little bit, but it will make sense later. My dad came from war-torn Europe. World War II had just ended, Greece was destroyed. He came here as an illegal immigrant, raised a family, went to night school, became a citizen, paid taxes. In fact, I went to his college graduation at the age of 5, and I was the youngest of 3. He really spent a lifetime in finance, acquiring companies, refining them, flipping them, taking them public. So you can say that I grew up really with a education in what I like to call the corporate playbook. It is that series of steps that you do when you buy something, increase its net worth, and then sell it. And that may or may not have positive results. I, however, wanted nothing to do with all that corporate fighting, so I decided to go to medical school, and we'll see how well that worked out for me. I'm going to use this example as one of the examples of the use of the corporate playbook, and it will make more sense later. Apollo is a company that was also put together by a Greek immigrant. He imported the finest ingredients from multiple sources all over the Mediterranean, used authentic Greek cooks, and there was a lot of them, and they had a lot of experience, and they made a wonderful product. My father was very instrumental in dismantling all of this good stuff and selling it to these folks so they could fill a frozen food package. A lot of people made a lot of money. I think in the end, that's what they asked him to do. And that methodology works for food and it works for toy companies, but it may not work very well for medicine. So my story is pretty simple. I went to college, met this lovely young lady. We got married, went to New York University, studied at Bellevue, did my stint in the Air Force because they paid for medical school. And we decided to go to Kennewick. We thought it was going to be a great place to raise our family. And it was. In the beginning, it was grand. This young lady, Caitlin, went off to Junior Olympics. This little tyke here became a veterinarian, who's marrying this young man next year. At that time, Kennewick had 3 independent hospitals: Trios, Lourdes, and Cadillac. And in fact, Trios was just KGH District Hospital. It had 3 independent orthopedic groups, which was the main drawing for us, for me anyway. BFOE actually didn't technically exist at that time. It was a group of 2 orthopedic surgeons. I initially interviewed with these folks, Northwest Orthopedics, but decided that I was going to join these 2 guys that were both married to sisters, whose mother was the office manager, and the only other orthopedic surgeon in Kennewick had basically been driven out of the group by the mother-in-law. So that may have sounded like an incredibly risky decision, but to a kid from New York, I looked at that as an opportunity. At that time, we covered call for the hospital. They didn't pay us. We just did it. But they also co-recruited new physicians for us. In fact, Lourdes recruited this young lady for us. She joined me, the 2 guys that were married to the sisters. We incorporated the other gentleman in town, and we became Benton Franklin Orthopedics. We hired some PAs, some physical therapists. When I joined those 2 guys, they didn't even have employee health insurance or retirement plan. Karen, in fact, my wife, she administered the first retirement plan. Everything was great. And then the lawsuit. Columbia Physical Therapy, a large conglomerate with multiple offices, in an attempt to change Washington state law, sued us a small fledgling orthopedic group in an attempt really to change law in Washington state. That battle would have been lost were it not for all these folks: the Washington State Orthopedic Association, the WSMA, the AOS, the AMA, county medical societies. We won a Supreme Court decision clearly indicating that we have the legal right to employ physical therapy. So if anybody out there has their own physical therapy company, you might want to thank these guys, because I think there's a message here. This was my first real battle with corporate medicine, and we would have lost it did we not have some unity with all of the other people in the WSOA. So I'm going to talk tonight a lot about the corporate playbook. And what I mean by that is a series of steps that any corporation does to move into an area, take over a market, intimidate competition, eliminate competition, develop a monopoly. This is just the first page in that classic playbook. But we're going to start with looking at the players at that time. At that time, Trios wasn't really Trios. It was Kennewick District Hospital. When I came along and we formed BFOA, they signed a physician service agreement with us. They put me on the board, in fact, for a short period of time. We hired a new CEO. We started a total joint program. I came off of the board because we did this, a joint venture between us and the hospital with the ASC. I mean, life was good. We worked hard, they worked with us. We decided to even build a new hospital, Trios. That was met with enormous challenges from Catholic Hospital and Quorum Health. Quorum Health was the medical management group that Catholic had paid to essentially block the building of the new hospital. In fact, they even built a freestanding ER 10 blocks down the street from Trios. At that time, Trios had a group health contract and we depended upon it for finance. We lost that contract, some people say because Catholic signed the group health contract at a loss. This essentially started the bleeding of money from Trios, bankruptcy, loss of Glenn as our CEO, and ironically, Trios now hires Quorum as their management group. This is ironic because it was Quorum that in fact was responsible for the bankruptcy of Trios. The first thing they did, by the way, was cancel the total joint program. Unfortunately, that playbook backfires on Catholic. All the money they spent fighting Trios causes them to be gobbled up by Providence, which promptly starts a transfer center to increase volume. They cut physician reimbursement to reduce costs. There's a massive loss of physicians at Catholic. In fact, 2 or 3 of our general surgeons at Trios came from Catholic. TCO leaves Catholic to go to Lourdes. And in the end, Northwest Orthopedic sadly becomes employed. Over at Lourdes, which was the oldest hospital in the Tri-Cities, they wind up getting bought by RCCH in 2019. RCCH also acquires Trios in the bankruptcy deal. Lifepoint merges with RCCH, and now this is the new player in town, Lifepoint Inc. They own and operate 2 out of the 3 hospitals in the Tri-Cities. They're headquartered in Tennessee, and they are really a corporate business. And they are going to bring their corporate playbook to our town, and in fact, they do. Corporate medicine now runs healthcare in Richland, Kennewick, and Pasco. And the battle between corporate giants, so to speak, is on, with physicians and the consumer caught in the middle. We're going to learn some lessons about this corporate playbook and what happens when you apply it to food and when you apply it to healthcare. We're going to go through some of those pages in the playbook. The first page, being that you really can't affect fixed overhead, is to go after your variable overhead. And that means employee salaries. We start with the almost universal reduction in force, whether they call it that or not. And you just don't fire people across the board. You selectively pick out the oldest, most experienced, most expensive employees and sequentially replace them with younger, less experienced, but often less outspoken, but definitely less expensive workers. You come up with a bunch of charts and data that increase care ratios. The ultimate result is a general decline of care. The next thing you go after is the supply chain. Using the analogy of Apollo Foods, do you really need all those finest ingredients from all across the Mediterranean that you now have to store in inventory for 3 months because the supply chain could be interrupted? No, you reduce your vendors. It doesn't really matter whether the physicians want those vendors or they're familiar with those vendors, but you're going to reduce your number of vendors. You're going to reduce stock to a 2-week supply. Why? Because that's what the corporate book says. And the vendors are usually going to be the lowest bidder. So what are the consequences of this? Well, as a surgeon, I no longer have familiarity with my equipment. I'm back on the steep end of the learning curve. There's the potential for inferior equipment and always the potential for out of stock. With the 2-week supply, when I'm on my 5th hip fracture and it's the weekend and the 85 millimeter screws are gone, they start looking at me like, hey, can you deal with a 95? There's the inevitable event of negative outcomes. The next step after you've squeezed every dollar out of the overhead is increased volume. And here we go back to the transfer center. Regardless of whether the subspecialists agree or not, administration goes out and starts dragging every case they can to your hospital, often without knowledge of even the resources of the hospital. This can lead in time to EMTALA violations. We can talk about that later if we want. The ultimate page of the playbook is gain control. Cancel the professional service agreements, raise rents for independent practitioners, redo call contracts. In fact, I'm now on my 4th rendition of the call contract with trios. We keep crossing out sections, they keep putting them back. You stack hospital committees with employed physicians. The ultimate aim is to update the medical staff bylaws, which you can translate to enforce the policies of the corporate procedures. And eventually, if you don't agree, there's always economic credentialing. The ultimate goal, complete control of practitioners, both employed and independent, and silence physician and nurse concerns. The reality is that decisions for healthcare are now made thousands of miles away. CEOs cannot make a decision on their own. They have to get headquarters approval from Tennessee. In the past, CEOs were local members of the community. I had dinner with them. They visited my house. They brought me beer on my 50th birthday. Now, the current CEOs are on a 3 to 5 year rotating cycle. And in fact, they might not even be here in 3 years if they don't maintain profitability. The other reality is that they commoditize medicine. Hospitalists, anesthesiologists, ER physicians, they all become widgets, ever replaceable by another widget. The ultimate outcome is that the ever-changing staff that don't know each other, unfamiliar with the hospital, with decreased resources, creates the setup for what I would consider sentinel events. This reality was brought out by the pandemic. When you decrease inventory to a 2-week supply and a pandemic interrupts your supply chain, now you have a problem. Because after all, medicine is not a toy factory. If you run out of wheels for the wagon, you can put the wagon on back order. But when you run out of PPE in the middle of a pandemic, you have the potential for death. In addition, the whole ballgame is being run from Tennessee that may not understand my community. They don't understand the meatpacking plant in Pasco, the prison, Hanford. So decisions are made that out of touch with the local community needs. And we saw this quite evidently in how they reacted to the pandemic. So what are the lessons from the corporate playbook and Greek pastry? You can buy the cheapest ingredients, which are not Greek. You can use the youngest cook, who's definitely not Greek, and you may make a cheaper Greek pastry, but it rarely results in a tastier one. It does fill the frozen food section. Hopefully nobody will notice the difference in taste. And ergo, it's why I say it's a bad time to get sick in America. So this is where we stand now. Lifepoint is the largest gorilla. Providence, Catholic, owns Northwest Ortho. TCO and BFOA is sort of on the outside looking in, hoping to survive. So do we give up? I would say not. Recommendations would be to attempt to maintain independence. And what I would like to call own the entire delivery system. The Academy calls it owning the bone. I believe you should own your buildings, your surgery centers, maybe even your hospital like the Postfall guys did. And even consider device manufacture and distribution. When I first came on the AOS, the president of the Academy stood up in front of everybody and said, physician-owned hospitals were not owned by enough orthopedics to make it worth the Academy's effort to support them. It's now tier 1 on the Academy's list. And I want to make it clear I'm not speaking against employed physicians. I'm merely saying that the independent option gives all physicians room to negotiate. Without independent physicians, there is only corporate America. And my final parting thought is that I went into medicine to avoid these corporate battles. And that didn't really work out so well. But what did was the job and the life that we created in Washington. And for that, I wouldn't exchange anything. Thanks.